Hello community, today we're talking about how the ways our society is structured can change our risk for Alzheimer's and dementia. A researcher named Adkins-Jackson and her team looked deeply at what factors might shape AD risk. What they found is that the systems that shape our lives, like economic inequality, discrimination, lack of access to good healthcare, and neighborhood conditions, builds up over time and can increase a person's risk for Alzheimer's. These are called social and structural determinants of health, and they're not just background factors. They directly impact brain health differences we see across communities. For example, other research shows that African Americans are about twice as likely and Latinos about 1.5 times as likely to develop Alzheimer's compared with white communities. Scientists believe these disparities come not just from biology, but from differences in structural and social access. As for folks in the Afro-Latino community, these challenges can stack on top of each other and raise risk even more. Research is only beginning to look at these intersections, but what we already know points to serious concerns that need more study and more community voices. Let's be honest, science so far hasn't fully evaluated these relationships, especially how racism and social inequity cause brain health differences. But the evidence we do have shows a clear pattern. Social and structural determinants of health are increasing Alzheimer's risk for Black, Latino, and Afro-Latino communities. That's why your voice matters. When you share your experiences, when you speak with researchers, when you show up for research studies, you help prove what we already know from our lived experiences. These social forces affect our health. Your stories can build the evidence that leads to change.